this is Donna Taggert, the dietitian for the Department of Aging and Human Services. November is actually Diabetes Awareness Month. So what is diabetes? It's a disease that occurs when your blood sugars are too high. When they're not managed, it can affect your kidneys, your heart, your eyes, your nerves, and other organs. So let me give you some stats. In the United States, 37.3 million Americans are living with diabetes. 96 million have pre-diabetes. I'll talk to you about that in a minute. $327 billion is the annual cost of diabetes. And this is kind of scary, staggering. 1 in 4 U.S. adults have diabetes and they don't even know they have it. So, pre-diabetes, what is that? That's basically when your blood sugars are running a little high, not high enough to be diagnosed with diabetes. Kind of like a red flag, a warning flag. Let's get some things changed in your life that maybe are leading to this. So, it's a good thing to know that you have pre-diabetes, but can be scary. So what are the risk factors for type 2 diabetes? Some we can't help. We can't help getting older, we can't help our family history, but we can help if we're overweight. Not easy, but we can address that. 74% of Americans are overweight. We can help eating unhealthy foods. Not easy, but we can. Another risk factor is being inactive. Only 24% of Americans meet the guidelines of 150 minutes per week for exercise. And another risk factor is smoking, which actually increases the risk of to 40% for developing type 2 diabetes. 34 million people still smoke. 58 million are secondhand smoke exposure. So anyway, how do you figure out if you're at risk? Very simple, 1-minute quiz. You can go on diabetes.org. It's the American Diabetes Association's website. Great website for lots of information. Plug in the little answers and they will tell you how much you are at risk, recommendations depending on where you fall on that scale. So let's talk about the different types of diabetes. Type 1 diabetes. 5 to 10% of the population have it. It's an autoimmune disease. It often occurs after a viral infection of some sort. So the autoimmune is in place and then this virus, they think, triggers the whole process where the cells in the pancreas that produce insulin are destroyed and they have to be on insulin. Can start at any age though. That's the scary thing because people think it's a childhood disease, but if that whatever triggers that autoimmune process doesn't happen until could happen in your 90s. It could still be a type 1 diabetes diagnosis. And a lot of physicians might miss that because it's not very typical. So if you're getting treatment for type 2 and you're doing everything you should, you're taking the medication and it's not working, you might want to see an endocrinologist and maybe get some tests, antibody tests, C-peptide will indicate if it's truly indeed type 1. Not typical because type 2 diabetes is the big usual number of people have type 2. And it usually develops later in life as things happen. But sadly, our children, a lot are at risk for type 2 because obesity is growing with children. They're not very active. So again, it's not totally just older people either, type 2. But they have a lot of the similar symptoms as type 1, excessive thirst, excessive hunger, urination, and sometimes you can explain that away when you're getting older and not realize that they are symptoms of type 2. If you get a cut, say, and it's not healing well, that's another symptom or sign, and maybe tingling in our hands or feet, another sign of type 2. Another diabetes is gestational. That's when you get it when you're pregnant. 10% of pregnancies in the United States are affected by that. The thing with that is, if you don't continue the recommendations and the management you did when you had diabetes during your pregnancy, very, very high risk of developing type 2 later on. So, how do we treat this? The American Diabetes Association, I told you, great website, diabetes.org. Obviously, you want to address the risk factors, starting, of course, going with your doctor, but some of the risk factors. Do you smoke? Get help. Health department has lots of smoking cessation programs. If you don't exercise, you need to exercise. You've been cleared by the doctor, don't know how to get started, lots of things. The senior centers have lots of great exercise programs. They're wonderful. Local colleges have some. The Health Connections have some. Lots of things going on that help you get started with exercise. Find somebody, make them hold you accountable, and find something you like. That's important. Okay, how about food? Well, that's my expertise, and I will tell you right off the bat, there's no one single diet that's a diabetic diet. There's lots of different lifestyle meal patterns that can address diabetes, and the most promising, you've heard it so many times with so many things from me, Mediterranean diet, right? Mediterranean diet has been shown to decrease the risk of developing type 2 diabetes, but also in the management type 2 diabetes. So again, looking into different things with your diet is important. That website I told you about, diabetes.org, has a diabetes plate method. There's going to be a PDF at the back so you can look more into it. But basically what they've done is taken my plate, which is for general population healthy eating. It's a 9-inch plate, but this is the my plate. So instead of this fruit vegetable section where half your plate is fruits and vegetables, this is all non-starchy vegetables on the diabetic plate. Protein's still the same. The grain area and the dairy is actually called carbohydrate section, I think it's called, and it's kind of the fruit, the dairy, and the grain combined. Recommending 3 carbohydrate servings per meal. So say you have a piece of fruit, there's 1. Say you have brown rice, 1/3 of a cup at dinner, there's 2, and then a glass of milk with your dinner, there's 3 carb servings for that. And that's how they incorporate that to manage, because the amount of carbohydrates affect your blood sugars. And there's a lot of good information on what serving sizes, what foods are carbohydrate. So please check that out. It's a great resource for you, and a really easy way rather than getting all stressed out over things and what to eat. So finally, what can you do to either prevent diabetes or manage it? Obviously, following up with your doctor. They'll do an A1C test. That is a blood test that kind of is a weighted average over the past 3 months. It kind of gives you an idea of what your blood sugars have been doing, how high they've been, and if appropriate, they'll make recommendations. Managing your blood pressure, your cholesterol. Second thing is making lifestyle changes to build healthy habits. Small changes to eat healthy. Small changes to exercise. Small changes to get enough sleep. And eventually those small changes make healthy habits. Third, take care of your mental health. Anytime you have any kind of chronic disease, and diabetes obviously is one of those, you can get anxious, you can get stressed, you can get depressed. So make sure you address your mental health. That's really important, because all those things ultimately kind of circle around and affect your management of your diabetes. Taking your medications as recommended on time. You may think, oh my gosh, there's so many diabetes medications. Well, that's because type 2 diabetes is a complicated disease, and it can affect different things, and therefore different medications are recommended. So don't be discouraged if you might be 2 or 3 different medications, where someone with type 1, they may just need insulin because that's all that's wrong. They just don't make the insulin. And eventually type 2 can also go on insulin. It doesn't make you all of a sudden a type 1 diabetic. It just means you're someone who now needs insulin that has type 2 diabetes. So it's not easy. Obviously not easy. But you can do it, and there's lots of people around that it can help you. Your primary care physician, health clinicians at the hospital, the health department, of course us here at the Department of Aging and Human Services, all kinds of programs. I am a certified diabetes educator, so you can always make a private appointment and see me for consultation if you need that too as well. So please don't get discouraged. This month is important because it gets you aware that diabetes is a serious disease. It's like there's a lot of people with it, but we can deal with it together. So I'll see you next month. We'll be doing something a little bit lighter, all about smoothies and how to make a healthy smoothie and enjoy a holiday smoothie over Christmas time. See ya. Thank you. Bye.